that as they do that, they probably, as everyone comes out underneath their rock, that their bodies aren't going to be ready to like get, increase their metabolism. So blood flow is going to be needed, so they can increase that. And I know we talked about this earlier, but I do love the story about, personally about blood flow to the body and increasing our metabolism and energy. Why is Arginix so uniquely poised in that regard?
For the blood flow, for as Dr. Siebel was talking about, one of the things that we had done was, with my background in running, and triathlons, I asked him, I said, well, can we do a study and to see how Arginix does with lactic acid reduction? And that's when so he said, yeah, let's put one together. This is again one of the blessings that I have working with this kind of a physician, because we'll come up with an idea of how it can benefit our patients or benefit the public and everything. And so fortunately we have a facility here that we can bring runners in. We have our lab here. We draw baseline lactic acid levels, put them on treadmill, max them out, have their heart rate measurement, the oxygenation set up going through, hit the wall, do their immediate lactic acid level, 15 minutes, 13 minutes, 5 minutes, 15 minutes, and 30 minutes later. And then we bring them back the following day, and we gave them a serving of the Arginetics. And after we had drawn their lactic acid level, and we waited 1 hour and put them back on the treadmill for the same exact regimen, which they did not know how far they had gone. They did not know their heart rate variabilities, things like that at all. 100% of the runners, Bill, 100% of the runners went farther, on the second day. 100% of the runners had less lactic acid buildup. 100% of the runners had a shorter recovery period down to baseline resting heart rate. I had some serious athletes in the study. I had a two-time All-American track and cross country NCAA runner in the study. I had a runner who just graduated from Navy SEAL training. At Army Ranger in the study. I had some really pretty fit people in the study. 7 men and 3 women. It's a small study, but we wanted to see how that would make a difference. And so going to that aspect of it there was that our arginine, our arginine alpha-ketoglutarate, has a higher absorption rate, than regular L-arginine. So with a problem in the gut, if you have a breakdown in the gut, which is your second brain, if you have the inability to, say, having diabetes and having a problem with malabsorption, if you're going to have a problem with getting total absorption of arginine, we want you to have the best type of arginine, to be converted to nitric oxide, since it does so rapidly. So we use a different type of arginine alpha-ketoglutarate, along with our L-citrulline. So with that aspect of it there, we get a higher absorption rate. Then we also get a higher absorption rate with one of our other proprietary ingredients, with our estrogen. So what that does is that does not only for the athlete, who wants to go better and recover faster on from, say, going from the bike up to the run from the triathlon, or say from the volleyball player, if you're going to be doing repeats, every week on the weekend that you're going to be doing, and you're going to be doing sand volleyball and everything, and you know what you're going through on your legs. That aspect of it there, or from just our we have soccer players that we're doing. Let's say that they're all the same pretty much same level of skills. At this 18-year age. What they did with the coach, who was a former professional soccer player for 18 years, what he did was he had his players taking the Arginetics at halftime versus regular sports drink. When did that kick in? That kicked in basically in the last 10 to 15 minutes of the game. When you need the freshest legs? The last 10 to 15 minutes of a soccer game, right? Right. Because that's when your speed, where you need to go ahead and go ahead and take it into overtime, or what you mentioned, when you need your LeBron James type of moves. That fine, and that's where we have that ability, to go ahead and be, I think, better than other sports drinks and ingredients.
That's remarkable. So in other words, they kept, your athletes always or like, especially like soccer is an incredible example because it gets back to what we were saying earlier. Athletes take in a game, basketball players too, they'll take a couple minutes off. You don't know when it's going to happen. Even when they're in the court, they can't go 100% for all 40 minutes. No athlete can. But the ability to not lose your legs, so to speak, in the fourth quarter of a game or last few minutes of a game or in the extra time or the last few minutes of the soccer game, that extra time, especially soccer. Like soccer is remarkable because those guys, the amount of wind sprints, the 70-yard wind sprints they got to do in a game, there's probably 50 of them. Exactly. And so if they're saying their ability to go through the wall, never hit the wall, or maintain their pace and their level, while other guys basically hit that wall, is a remarkable feat in itself.
We're looking forward to expanding this out into the professional market. Okay, as we move forward here, hopefully later on. Well, until this pandemic hit and everything, we were ready to try to get that here first and middle part of this year. But we know that what we have in our product, what it does and so forth. We just need to also let that professional athlete, because we have many retired professional athletes that are using the product to keep their weight down, to keep them in shape after they've retired, especially from football, other sports. And so they've given us really good feedback as far as what the product's done for them, just for overall energy. And then from what, if it's from different ethnicities, if they're affected by high blood pressure when they retire, if they're affected by other cardiovascular disease issues, other vascular issues, things like that, diabetes, and the African American and the Hispanic patient population. So we're having great benefit. And this is, for me, that's the reward from the nursing standpoint, because I can educate my patient population in my clinic. I have a certain number of patients that I can educate. So and I've traveled around the world, speaking on L-arginine, and the benefits of L-arginine nitric oxide around the world. And so where can we try to get to the best market, the best education educate the people most on trying to do what Dr. Phil Maffetone talked about, was the perfect storm of when you have a pandemic, such what we're facing right now, colliding with a society, or a world that is overfat, which means that you have diabetes, which is obesity and diabetes. You have hypertension, a highest number of cardiovascular disease patients worldwide. Colliding with this pandemic. So we need to have tools in our toolbox. That we can be able to utilize, educate. The public on, educate our patients on, which we've been doing for years now. Fortunately with Dr. Siva's assistance, and it really is forethought on that aspect of it there. Continue to do that. So that's what keeps me going. That's what keeps me excited.
It should, because especially if you get back to like old NFL football players, if they're using argininics to, one, keep their metabolism and keep themselves going when their bodies have imploded, many of them, or they're especially great examples like offensive linemen who are 320 pounds. And I know a couple guys that took them literally 10 years to get to 215.
Yep.
And the purpose of that wasn't just so aesthetic, it was actually their quality of life.
Correct.
I mean, you can't be 330 pounds
Correct.
and be 52 years old. You
Correct.
won't make it to 56.
You won't make it to 55.
And
Correct.
so those guys are actively doing everything they possibly can to keep themselves in shape, to just, and they've had 20 years to learn how to conduct themselves with eating habit that was designed around huge calorie intake and building up a robust body fat to absorb punishment, and then to immediately, or not immediately, but eventually to turn that over into a situation where they have to become a functioning human being at 215 pounds.
Yes.
They need all the help they can get. So I am amazed if they use argininic at capacity. How did they do that? How long was, in some of these anecdotal stories, how long did it take them to to do a 180 on their life, with Argenx now?
Well, one of the persons that was using switch was a future Hall of Fame linebacker. Okay, and he went so his thighs are like stumps, and so
Right.
when he did to help keep weight down and keep him keep in shape and everything he was doing a lot of bike riding.
Mm-hmm.
Okay. And that's where he sort of noticed that one, he was keeping lactic acid down, he was keeping his weight down, his recovery was a lot quicker, returning back. So he was, because he was riding with a person that introduced him, Greg Harrell was the person that introduced him to the Argenetics, and Greg is a former Italian football player for the NFL. But we had when they he basically saw results. He was seeing results within 30 to 90 days. Okay, as far as depending upon what his regimen was on the bike on the bike route. I think the thing is that people ask me the questions: how long do I need to use Argenetics? And so I'm asking my patients who have high blood pressure, who have diabetes. I ask my patients since I've seen hemoglobin A1Cs drop by a full gram in 90 days. Okay, because what we do is we'll do their, like Dr. Sieber was saying, we've measured our patients the last 10 years. We've taken our patients from an 84% deficiency of vitamin D and brought it down to, actually I think it's less than 26% and everything in that time period. And that's think about that. That's an aging population.
Mm-hmm.
Okay, so it's an aging population, so the patients have gotten older. So some of those, think about some of those side benefits. The patient is actually, as he or she is getting older, we're also strengthening their bones. Okay, so we're preventing fractures, hip fractures on falls and things like that. So it's all these things that we don't really think about in healthcare, sometimes in healthcare. Okay, but we're doing that almost like an incidental benefit on that aspect of it they're going through. So with the aspect of it going through, the patient who's got diabetes, especially you'd be surprised in the African American patient population, that 330-pound offensive guard, he'll develop that diabetes probably within 6 months after retiring from football. He doesn't already have it.
Right.
And so that's one of the biggest challenges we have going through is we can go ahead and we can really, happiest thing for me is when I can sit there and reduce my patients, insulin amount, reduce my type 2 diabetic patients' oral medications, okay, with this nutritional supplement. To me, I'm in heaven when that's what they're going through.